Good evening. This is All India Radio. I am Anuja Kumar, and with me is R.S. Raghu with the evening news. The headlines. COVID-19 recovery rate rises to 41.61% in the country. Fatality rate goes down to 2.87%. Phase 2 of Vande Bharat mission to be expanded to bring back 1 lakh stranded Indians from 60 countries. Union Minister and BJP leader Prakash Zavadekar hits out at Congress for playing politics during the fight against COVID-19. Arogya Setu becomes open source. Government highlights transparency, privacy and security as the core principles of the app. Health Secretary reviews COVID-19 situation in 5 states where cases are on the surge. Validity period of hotel approval and classification extended till 30th of June. And heat wave conditions continue in northwest and central India. Temperature in Churu, Rajasthan reaches 50 degrees. The Health Ministry has said that the recovery rate of patients from COVID-19 infection has now gone up to 41.61%, which was 7.1% in March this year. Briefing media in New Delhi, the Health Ministry official said that the fatality rate due to coronavirus infection has come down from 3.30% to 2.87%, which is amongst the lowest in the world.
अब देश में 60,490 पीपल रिकवर हो गए हैं और उसके साथ ही जो हमारा रिकवरी रेट 7.1% करीब मार्च में था वह बढ़ते बढ़ते 11.42%, जबकि हमने सेकेंड लॉकडाउन शुरू किया। थर्ड लॉकडाउन शुरू करने के समय पर वह बढ़कर 26.59% हुआ और आज हम देख रहे हैं कि फील्ड में एफर्ट्स करने की वजह से वह लॉकडाउन के इस प्रेजेंट टाइम में बढ़कर 41.61% हो चुका है।
He said due to the lockdown and containment measures taken by the government, 10.7 cases per lakh population have been reported in India as compared to 69.9 COVID-19 cases per lakh population for the world as a whole. The official said 4.5 deaths per lakh population have been reported for the world, while India has reported about 0.3 deaths per lakh population, which is amongst the lowest in the world. The Health Ministry official also appealed to people to maintain hand hygiene and social distancing and wear masks while stepping out. He said there is a need to focus on prevention and containment measures. He said about 50% of deaths are reported among elderly people, while 73% are reported in the patients with comorbidity.
करीब 50% डेथ केसेस एल्डरली पॉपुलेशन में रिपोर्ट हुए हैं और साथ ही करीब 73% केसेस जो डेथ के हैं वह पीपल विद कोमॉर्बिडिटीज में रिपोर्ट हुए हैं। तो हम प्रिवेंटिव एस्पेक्ट्स को लेते हुए अपने घर में जो एल्डरली हैं, अपने घर में जो वल्नरेबल पॉपुलेशन है, उन सबको बचाने के लिए सारे प्रिवेंटिव स्टेप्स लें। अगर हमारे को कोई भी ऐसा केस दिखता है कि जिसमें कोई हमारे को सिम्टम्स हैं तो हम गवर्नमेंट द्वारा ऑर्गेनाइज की फैसिलिटीज को एक्सेस करें।
ICMR Director General said that currently over 1 lakh samples for COVID-19 are being tested in a day. He said the country has now 612 labs.
Today, as we speak, we have about 612 labs, out of which 480 are public labs and 182 are private labs. And we also have the TrueNat and the CBNat, etc. being used for testing.
Health Secretary Preeti Sudan, along with senior officers of the Union Health Ministry, held a high-level review meeting through video conference today with the Chief Secretaries, Health Secretaries and NHM Directors of Uttar Pradesh, Bihar, Jharkhand, Chhattisgarh and Madhya Pradesh. These states are witnessing a surge in COVID-19 cases since the last 3 weeks as lockdown rules have been eased and interstate migration has been allowed. The states were briefed on the individual case trajectory with respect to case fatality rate, doubling time, testing per million and confirmation percentage. Factors that need to be focused for effective containment strategy were discussed in the meeting. It was also emphasized that each containment zone has to be analyzed to check the trends and adopt course correction measures through proper formation and implementation of microplans. The activities within the buffer zone were also reiterated. It was reiterated that states need to pay focus attention on assessing the available health infrastructure and to strengthen them. Use of data emerging from Arogya Setu was also pointed out to the participating states. Regarding non-COVID essential health services, the states were reminded that immediate measures need to be taken to continue essential health programs for TB, leprosy and non-communicable diseases like hypertension and diabetes. It was advised that mobile medical units can be stationed at quarantine centres and temporary sub-health centres could be set up in existing buildings and additional frontline workers can be utilised.
External Affairs Minister Dr. S. Jaishankar today held a detailed review meeting of Vande Bharat Mission VBM. The meet focused on to ramp up its scale and enhance its efficiency. In a series of tweets, Dr. Jaishankar said the meeting discussed further expanding Phase 2 of VBM, which is currently underway. It will target 1 lakh passengers from 60 countries. He said preparations for third phase of the mission was discussed and increase in entry points and expanded feeder flights are being planned. He said Indians returning through land borders has started today. The minister added that arrangements being made for amnesty beneficiaries in the Gulf. He informed that naval evacuation of Indian fishermen in Iran will happen in June. Dr. Jaishankar also said Air India will shortly shift to direct ticketing to facilitate bookings abroad. He said the centre is working with state governments for more efficient use of cumulative quarantine capacity. As part of Vande Bharat mission, 9 flights will carry stranded passengers to Kerala today, of which 8 are from Gulf region and 1 is from Israel. Flight from Abu Dhabi, Dubai and Bahrain will arrive in Kozhikode today by late evening. 2 flights are scheduled to arrive in Kochi, 1 from Dubai and another Tel Aviv, which will be reaching in a short while. 2 flights are also scheduled to reach in Thiruvananthapuram and Kannur from Dubai and Abu Dhabi today. Over 1,000 Indian nationals will be reaching Kerala today under the mission.
In Bihar, the 4th Air India flight AI-1952 under the Vande Bharat mission carrying 127 stranded passengers from Bishkek, Kyrgyzstan reached Gaya International Airport this evening. Passengers who came today were sent for 14-day quarantine. The state government has arranged a hotel for passengers. 6 flights have so far been scheduled to land at Gaya Airport. These flights will come till the 3rd of next month. In Andhra Pradesh, domestic flight services resumed this morning almost after a gap of 2 months from the 2 airports of the state. The first flight by a private operator from Bengaluru landed at Gannavaram Airport in Vijayawada early today with 79 passengers. As per the airport director Madhusudan Rao, the aircraft also returned to Bengaluru with 68 passengers on board. Another flight from another private operator from Bengaluru also landed with 48 passengers and departed with 50 passengers on board. Similarly, Visakhapatnam Airport is scheduled to handle flights today from Hyderabad, Bengaluru and Delhi. As per the state government officials, the passengers who land from Delhi will have to be in institutional quarantine for a week and then they will have to be in home quarantine for 1 more week. All the passengers in both the airports are being handled as per the Union Health and Family Welfare Ministry's guidelines.
From the Chennai airport, 41 flights are being operated on the second day of the resumption of domestic air services today. They include 21 arrival and 20 departures. Meanwhile, the state has witnessed 642 new COVID-19 cases, taking the total infected cases to 17,728. They include 509 from Chennai, 49 returnees from other states and 5 from abroad. 9 people lost their battle against the disease today, mounting the total mortality to 127. Most of them with comorbidity conditions. 600 patients returned home after cure, leaving the current caseload at 8,256. More from our correspondent.
As the current phase of the lockdown draws to a close by the end of this month, the medical experts meeting has been held today. Testing strategies, treatment protocols, reducing mortality, special measures for the vulnerable groups and hospital preparedness have been discussed threadbare in the meeting. Chief Minister Edappadi Palaniswamy, Health Minister and key officials listened to the experts at the Secretariat at Fort St. George in Chennai, while the World Health Organization Chief Scientist Dr. Soumya Swaminathan joined through video conferencing from her Geneva office. The director of the Christian Medical College Vellore and the president of the Indian Medical Association from Erode also participated in the consultations through video conferencing. It is said that the state government will take into account several other key factors also while deciding on the future course of the lockdown. Jai Singh, AR News, Chennai.
The Civil Aviation Ministry has allowed domestic chartered flights and private jets to resume their operations. The ministry had issued an order in this regard yesterday. After a 2-month gap, the country resumed its domestic passenger flights from Monday. The ministry said that non-scheduled and private operator of fixed-wing aircraft, helicopters and micro-light aircraft can resume their domestic flights from 25th of May onwards. As per the guidelines issued in this regard, the ministry said if a passenger had manually booked his or her ticket for a chartered helicopter flight, the boarding pass will be issued at the helipad or heliport with minimum contact and after following all sanitization protocol. It said passengers should report at the airport, heliport or helipad at least 45 minutes before the departure time. Vulnerable people such as very elderly, pregnant ladies, passengers with health issues are advised to avoid air travel.
Union Minister and senior BJP leader Prakash Zavadekar today hit out at the Congress saying when the country is fighting to contain COVID-19, the Congress is playing politics on it. Talking to media in New Delhi, Mr. Zavadekar said, while the whole world is appreciating India for imposing the lockdown at the right time, the Congress is criticizing it. He said Congress leader Rahul Gandhi's press conference today is an example of the politics the Congress is doing, and what he said about the lockdown is wrong as well. Mr. Zavadekar said the COVID-19 doubling rate was 3 days before the lockdown, and it is 13 now, which reflects India's success. He said 45 lakh migrant workers were transported to their home states by over 3,000 special trains, citing various welfare provisions of the central government, including 5-month free ration for over 80 crore poor and transfer of 2,000 rupees to 9 crore farmers. Mr. Zavadekar said these measures in real term are more than 7,500 rupees that is demanded by Mr. Gandhi for the poor.
जब लॉकडाउन लगा तब 3 दिन में संक्रमण की संख्या डबल हो रही थी। आज ये दर कम होकर भारत की सफलता है और मुझे आश्चर्य होता है जब लॉकडाउन लगा तब कांग्रेस ने हाय तौबा मचाया कि लॉकडाउन क्यों लगाया, पूरे देश भर में क्यों लगाया, अर्थव्यवस्था तबाह हो जाएगी। यानी जब लगा तो भी विरोध किया, अब अगर उठ रहा है तो उसका भी विरोध करेंगे।
Arogya Setu, India's COVID-19 contact tracing, syndromic mapping and self-assessment mobile app is now an open source. Announcing it this evening in New Delhi, Niti Aayog CEO Amitabh Kant said transparency, privacy and security have been the core design principles of Arogya Setu since its inception, and opening of the source code up to the developer community signifies Government of India's continuing commitment to this principle.
We prioritized our functionality, which was COVID-19 contact tracing. Now we first focused on it, and now we have open sourced the product. I just want to point out that this is a very, very unique thing to be done, because no other government product anywhere in the world has been open sourced at this scale.
Mr. Kant said, today the scale and size of Arogya Setu is 115 million and it cuts across every smartphone and IVRS in 12 languages. He said in just 41 days, the mobile app crossed 100 million downloads.
Health Ministry has reiterated its appeal to the people to follow hand hygiene and social distancing norms to contain the spread of COVID-19 infection. In a series of tweets, the ministry has stressed that as a part of the new normal, people should always follow social distancing norms and wash their hands with soap and water or use alcohol-based hand sanitizer. The ministry said spitting in public is a punishable offence and it increases the risk of spread of the coronavirus. A report.
Health Ministry has urged people to wear face covers to protect themselves and break the chain of corona outbreak. It has also asked people to share authentic information and encourage people, if they develop symptoms, to get tested. Stigma can discourage people from seeking immediate help and contribute to more severe health problems. Therefore, it is important to break the stigma. Maintaining 2 gaj ki duri is important to ensure everyone's security. People should avoid touching their hands, nose and mouth. They should also refrain from consuming smokeless tobacco products and spitting, as it will not only improve the level of basic hygiene, but will also prevent the spread of coronavirus. If anyone develops symptoms like fever, cough and difficulty in breathing, they must immediately call the All India helpline number 1075. Suparna Sekhya, AIR News, Delhi.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. COVID-19 recovery rate rises to 41.61% in the country. Fatality rate goes down to 2.87%. Phase 2 of Vande Bharat mission to be expanded to bring back 1 lakh stranded Indians from 60 countries. Union Minister and BJP leader Prakash Javadekar hits out at Congress for playing politics during the fight against COVID-19. Arogya Setu becomes open source. Government highlights transparency, privacy and security as the core principles of the app. Health Secretary reviews COVID-19 situation in 5 states where cases are on the surge. Validity period of hotel approval and classification extended till 30th of June. And heat wave conditions continue in northwest and central India. Temperature in Churur, Rajasthan reaches 50 degrees. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
In a major relaxation to the tourism industry, the validity period of approval and classification of hotels and accommodation units has been extended till the 30th of June by the government. Ministry of Tourism classifies hotels under the star rating system. Under this system, hotels and accommodation units are given various ratings ranging from 1 to 5 stars, 5-star deluxe, legacy vintage, homestays, guest houses, including others. The government has decided that validity of approval or certifications of hotels and other accommodation units whose project approvals and classification status have expired or are likely to expire in the period from 24th of March till the 29th of June will be extended till 30th June. In addition to this, the Tourism Ministry has also allowed 6-month extension to the approvals granted to all categories of tour operators, travel agents and tourist transport operators. The extension is valid for the operators in case the already granted approval is likely to expire or has expired between 20th of March till the continuation of the lockdown and the operator has applied for a renewal. Railways has operationalized more than 3,060 Shramik special trains across the country to transport migrant workers to their home states. More than 40 lakh passengers have reached their destinations by these trains. Rail Minister Piyush Goyal has expressed happiness that the railways successfully operated more than 3,000 Shramik special trains and took migrant workers from different parts of the country to their home states. In a tweet, Mr. Goyal appealed to all the states to cooperate with the railways and help their labourer brothers and sisters. Our correspondent reports that 80% of these Shramik trains are scheduled for various destinations in Uttar Pradesh and Bihar.
Railways had started running Shramik special trains from 1st of May to move migrant workers, pilgrims, tourists, students and other persons stranded at different places due to lockdown. The top 5 states and union territories from where maximum trains originated are Gujarat, Maharashtra, Punjab, Uttar Pradesh and Delhi. These trains were terminated in various states across the country. Uttar Pradesh received the highest number of 1,245 trains, followed by Bihar 846 trains and Jharkhand 123 trains. During the journey, passengers are given free meals and water. In addition to Shramik specials, Railways is also running 15 pairs of special AC trains connecting New Delhi and has decided to start 200 more trains from 1st June. With Dipendra Anand Kumar, AIR News, Delhi.
Prime Minister Narendra Modi today expressed his appreciation for the support extended by Egyptian authorities for the safety and welfare of Indian nationals in Egypt during the COVID-19 crisis. In a telephonic conversation today, Prime Minister Modi conveyed greetings for Eid ul-Fitr to President Abdel Fattah al-Sisi and to the people of Egypt. Mr. Modi referred to his earlier planned visit to Egypt this year, which had to be postponed due to the COVID-19 pandemic, and conveyed his desire to meet President Sisi as soon as circumstances permit. President Sisi referred to Egypt and India as being among the oldest civilizations in the world and expressed happiness about the fast expanding bilateral relationship. Prime Minister Narendra Modi had a telephonic conversation today with President of Austria, Alexander Van der Bellen. The Austrian president condoled the damage caused in India by Cyclone Umpun. The leaders exchanged views on measures taken in their countries to manage the adverse health and economic impacts of the COVID-19 pandemic. They agreed on the importance of international collaboration to deal with the present challenges. Both the leaders emphasized their shared desire to further strengthen and diversify India-Austria relations in the post-COVID world. The Prime Minister highlighted opportunities for enhanced cooperation in sectors like infrastructure, technology, research and innovation.
The Uttar Pradesh government has decided to set up a migration commission to help find jobs for workers returning home. Additional Chief Secretary, Home and Information, Avanish Awasthi said any state that wants labourers from UP has to seek its permission.
उस आयोग का नाम है कामगार श्रमिक सेवायोजन एवं रोजगार कल्याण आयोग। आयोग के माध्यम से उनका निर्देश यह है कि सेवायोजन और रोजगार के क्षेत्र में, स्किल मैपिंग के क्षेत्र में, स्किल डेवलपमेंट के क्षेत्र में ऐसे जो श्रमिक और कामगार आए हैं, आवासीय सुविधा जो प्रधानमंत्री जी का पैकेज है उसका सहयोग कराने के लिए ऐसे जो व्यक्ति आए हैं उनकी अप्रेंटिसशिप करने के लिए, अप्रेंटिसशिप करने के समय ट्रेनिंग भी होगी, उनको कुछ मानदेय भी मिलेगा।
Chief Minister Yogi Adityanath also said that other states will need permission from the UP government if they want to make use of labourers from Uttar Pradesh. About 25 lakh migrants, workers and their families have returned to Uttar Pradesh from other states. At a meeting with senior officials, the Chief Minister reiterated that his government is committed to a safe and respectable homecoming of workers and to provide them with jobs and social security. In Mumbai, the Municipal Corporation of Greater Mumbai, MCGM, has devised a strategy to break the chain of the virus, which has resulted into scores of deaths due to COVID-19. Mumbai, as it is known, is the hotbed of coronavirus pandemic. The strategy will focus on isolating at least 15 high-risk persons who have come in contact of a positive patient, and they will be government quarantined. Over 1,000 deaths have been reported in Mumbai due to coronavirus. More in this report from our Mumbai correspondent.
Chase the virus and get on top of it is what the Mumbai Municipal Corporation has decided to do, in the words of its Commissioner Iqbal Singh Chahal. The strategy, he said, has been devised on the advice of Chief Minister Uddhav Thackeray to break the chain of COVID-19. Mr. Chahal said that even if the toll of COVID-19 patients has surpassed 31,000 mark, the active cases are about 22,000 in Mumbai at present. He said 17,000 patients have been cured and discharged from various hospitals. The Mumbai civic body has tested 13,000 people per 1 million population, and so far 1,75,000 persons have been tested in the metropolis. The commissioner also said that Mumbai has a robust healthcare system and 1 lakh beds will be available with the municipal corporation in upcoming days. As of now, he said the civic body has 75,000 beds to treat the patients. Kunal Shinde, AIR News, Mumbai.
A public-private partnership in India has yielded an important breakthrough that will help produce RT-PCR test kits for testing COVID-19 patients. Dr. Kiran Mazumdar Shah, the chairperson of Governing Council of National Biomedical Resource Indigenization Consortium, NBRIC, has said that 2 enzymes, namely Taq polymerase and reverse transcriptase, needed for RT-PCR test kits are developed in partnership with Bengaluru-based Indian Institute of Science and private partner Richcore Life Sciences Company. She has said that Pune-based Indian Institute of Science Education and Research has also partnered in the project. More from our correspondent.
India is set to locally produce RT-PCR testing and rapid antibody detection test kits for COVID-19, reducing dependence on imports. Helping this goal is the breakthrough by NBRIC in partnership with Richcore Life Sciences. The 2 enzymes developed by them form a key to India's efforts to produce the test kit. The chairman and managing director of Richcore Company, R. Subramani, has said that once these enzymes are approved and certified by CGMP, India can produce millions of test kits in a few weeks. Meanwhile, in a Facebook post, the Karnataka Primary and Secondary Education Minister, Suresh Kumar, has informed that over 2,19,000 samples are tested in the state, and out of which around 2,283 are confirmed positive. R. Murthy, AIR News, Bengaluru.
2 corona-positive pregnant women in Hazaribagh district of Jharkhand gave birth to perfectly healthy and corona-negative children and were discharged from the hospital today. A report.
Continuous efforts of our dedicated doctors and corona warriors are bearing fruitful results. In this connection, 2 newly turned mothers who once were tested corona positive during pregnancy had breastfed their newborns, and the reports of the babies came out to be negative. Both women belong to Katkam Sandi block and were provided with a balanced and nutritious diet after they were admitted at Hazaribagh Hospital for COVID-19 treatment. After delivery, both of them had continuously kept breastfeeding their newborns on doctor's advice. Both the newborns survived the COVID-19 infection. Hazaribagh Civil Surgeon Dr. Sanjay Jaiswal said that since newborns cannot be separated from their mother, they were kept along. Corona negative report of both the newborns is an achievement and brings some relief in this era of despair.
5 मरीज नेगेटिव जो कल हुए थे, आज उन लोग को हम लोग घर भेज रहे हैं। वो जो अब नेगेटिव हो गए तो घर जा सकते हैं, और उसमें 2 प्रसूति वाली जो है डिलीवरी हुआ था, वो भी जो है इंक्लूडेड। माँ का ब्रेस्ट फीडिंग हुआ, इससे भी इम्यूनिटी बढ़ता है। उनके बच्चे तो नेगेटिव ही हैं, इसलिए सब कुछ ठीक है, हम लोग उनको घर भेज रहे हैं।
The district administration and health department have made arrangements to send the mother and newborns along with other patients back to their home. With Shadwal Kumar from Hazaribagh, this is Shilpi for AIR News from Ranchi.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Ambuj Roy of Cardiology Department of AIIMS advised the elderly people and those suffering from other diseases like hypertension and cancer to take extra precautions to avoid the infection.
In the larger population, it has given them time to understand the seriousness of the disease, the precautions they need to take, how to live with it. They have practiced social distancing. The people who already have heart disease, people who have had brain strokes, people who have lung disease, people who have some kind of cancer, they're much more prone to a more severe form of the disease if they get the disease.
Dr. Naresh Gupta of LNJP Hospital, Delhi, suggested to the people to maintain hygiene and social distancing.
Sanitation, hygiene, hand hygiene, masking, this social distancing, nobody should try to break that rule, I would call it. The idea is when somebody coughs or sneezing, that cough or sneeze particles can travel 1 to 2 meters or even more. When one speaks loudly, it can travel to 1 meter.
In Nepal, 90 more persons tested positive for COVID-19 today. This is the highest number of coronavirus cases reported in a single day so far. According to the Ministry of Health and Population, the total number of COVID-19 cases have reached 772 in the Himalayan nation. On a positive side, 43 persons cured and discharged from various hospitals of the country today. There are now 613 active cases while 155 people have been recovered. 4 persons have died of COVID-19 so far. All 7 provinces of Nepal are affected by the coronavirus. Province 2 and Province 5 are the most affected by the COVID-19.
The government has refuted the claim that 10 people have lost their lives in trains due to hunger. Press Information Bureau has said that no such deaths due to hunger have been reported. It has asked people to refrain from spreading unverified news. India Meteorological Department IMD has said that northwest and central parts of the country continue to remain under the grip of heat wave conditions. Talking to AIR News, senior scientist of the IMD, Dr. K. Sati Devi, said that Chandigarh, Rajasthan, Haryana, Delhi, Uttar Pradesh, East Madhya Pradesh, parts of Chhattisgarh, Bihar and Jharkhand are expected to experience heat wave conditions for the next 2 to 3 days. She said these areas are likely to experience some rainfall activity from the 29th of this month. Now let's take a look at the weather forecast for tomorrow. Northwest and central parts of the country will continue to remain under the grip of heat wave conditions. The national capital Delhi will witness minimum temperature of 28 degrees Celsius and maximum 45 degrees Celsius. In Gilgit, the temperature will hover between 13 and 36 degrees Celsius. It will face mainly clear sky. In Muzaffarabad, there will be mainly clear sky becoming partly cloudy towards the afternoon or evening. Rajasthan is under reel of scorching heat and severe heat wave conditions. Churu remains the hottest place in the state, where temperature recorded 50 degrees Celsius today. It is the second highest temperature in the last 10 years. And now, before we end, the headlines once again. COVID-19 recovery rate rises to 41.61% in the country. Fatality rate goes down to 2.87%. Phase 2 of Vande Bharat mission to be expanded to bring back 1 lakh stranded Indians from 60 countries. Union Minister and BJP leader Prakash Zavadekar hits out at Congress for playing politics during the fight against COVID-19. Arogya Setu becomes open source. Government highlights transparency, privacy and security as the core principles of the app. Health Secretary reviews COVID-19 situation in 5 states where cases are on the surge. And with that, we end the evening news.